State health officials and lawmakers are ready to work together to stop the teen vaping epidemic. THV11's Mercedes McKay shows us what they're worried about, and why they say the problem is going to continue to evolve. Mercedes?
David, in the past 24 hours, another death was confirmed due to lung injury caused by e-cigarettes. That makes it a total of 5 deaths nationwide and over 450 illnesses, including at least 4 in Arkansas. Local health officials are trying to add more regulations in hopes of ending what some are calling this new disease.
I'm afraid this is going to continue to evolve and that the numbers are going to grow.
A sentiment shared by health officials nationwide. Lung injuries caused by e-cigarettes popping up daily.
Well, this is like a new disease that has emerged that we don't know the exact cause. We do know the exact exposure.
Dr. Joe Thompson, president and CEO of Arkansas Center for Health Improvement, says it will take the CDC quite a while to come up with the specific element that is causing this.
It may be more than one element. It may be people reacting in different ways to breathing this in.
According to the CDC, 44% of high school seniors have used an e-cigarette and 20% do so on a regular basis. Thompson says this is why several policies need to be put in place.
We need to add it to the Clean Indoor Air Bill. We need to raise taxes to make it equal to cigarettes. We need to allow local communities control over where these things can be advertised.
There are several misconceptions that Thompson believes teens aren't aware of. The main one, how much nicotine they are actually inhaling.
One Juul pod contains the same amount of nicotine as a whole pack of cigarettes, and some of our youth can go through a Juul pod in 20-25 minutes. So that's a big hit of nicotine.
The average age of patients showing lung problems from vaping is 19, so health officials are worried about teens becoming lifelong tobacco users.
I really do fear that our youth are seeing this as a fad, as something cool to do.
This is why Thompson is urging parents to take a closer look.
I would strongly urge every parent, whether you believe your child is or is not vaping, to sit down and have a candid conversation.
Educating teenagers now so that Arkansas doesn't add another to the list with vaping-related lung disease.
People shouldn't vaporize things and breathe it into their lungs and not expect bad things to happen.
Thompson says some of the symptoms of lung disease are shortness of breath, chest pain, and fatigue. Tomorrow afternoon, there will be a joint public health committee meeting where they will be taking a closer look at what can be done about e-cigarettes.